Have you ever looked in the mirror and thought, I'm doing fine? I shower, brush my teeth, wear clean clothes. I'm keeping up? You're not alone. Most older adults feel confident about their hygiene routines, especially if they've maintained good habits throughout life. But here's a startling truth. Doctors can often spot serious health problems just by noticing small hygiene details, things many seniors overlook. What if I told you that something as simple as skipping a foot check or using the wrong toothbrush could be silently signaling conditions like heart disease, diabetes, or even dementia? You see, personal hygiene isn't just about staying clean. It's often the first place your body whispers that something's wrong, long before any blood tests or scan detects it. And yet, these signs are rarely talked about in doctors' offices, hardly ever mentioned in magazines, and never taught in school. That silence is costing lives, or at the very least, quality years of independence. Let me introduce you to Harold, a 75-year-old retired engineer who thought he was doing everything right. He played golf, stayed active in his community, and never missed a Sunday dinner with family. But during a routine checkup, his doctor spotted not one, but 3 hygiene-related red flags. Clues that revealed Harold had been battling a serious condition without even knowing it. In today's video, I'm going to walk you through 7 personal hygiene mistakes that doctors instantly notice. And more importantly, I'll show you how simple changes could help you prevent life-altering illness and add years of health and dignity to your life. This isn't about judgment, it's about empowerment. And by the end of this video, you'll know exactly what to look out for and what to do instead. So stay with me. What you learned today could truly change your life or the life of someone you love. 1. Neglecting oral hygiene. Let's start with something most people take for granted: oral hygiene. You probably brush your teeth every day, maybe even twice. But here's the real question. When was the last time you truly looked inside your mouth with a critical eye? And no, we're not just talking about avoiding cavities or keeping your breath fresh. Research from top institutions like Harvard has shown a shocking connection. Gum disease can send harmful bacteria into your bloodstream, potentially triggering heart disease, stroke, and even cognitive decline. Yes, you heard that right. Your mouth could be quietly damaging your heart and brain. Take a moment and think. Do your gums bleed when you brush? Have you noticed swelling, or that your toothbrush is frayed and long overdue for replacement? These aren't minor inconveniences or just signs of aging. They're your body's red flags, and ignoring them could be a costly mistake. Let me tell you about Sylvia, a retired teacher from Oregon. For months, she dismissed her bleeding gums as normal, but during a checkup, her doctor discovered valve inflammation in her heart, directly linked to oral bacteria that had entered her bloodstream. Had she waited just a little longer, the damage might have been irreversible. Here's what you can do starting today. Replace your toothbrush every 3 months. Or better yet, switch to an electric toothbrush for deeper cleaning. Brush twice a day for at least 2 minutes. Set a timer if you need to. Floss every single night, even if you have dentures. And don't skip dental checkups. Your dentist may see things you can't. Good oral care is about so much more than teeth. It's about preserving your independence, your health, and even your memory. Don't let something so preventable become your body's ticking time bomb. 2. Infrequent bathing and skin care. As we get older, it's common to bathe less frequently, especially during colder months when skin tends to feel dry or sensitive. But cutting back on regular bathing might be doing more harm than you think. Your skin is your body's largest organ, and believe it or not, it can act as an early warning system for deeper health issues. Subtle changes in color, texture, or hydration can hint at problems with your liver, kidneys, or even blood sugar levels long before other symptoms show up. Many older adults believe that bathing just once or twice a week is good enough, especially if they're not physically active. But here's what often gets missed. When you don't cleanse the skin regularly, you're not just skipping a shower, you're skipping a critical health check. Let's take Clarence, a 77-year-old retired postal worker from Michigan. He thought bathing once a week was fine. But when his doctor noticed unusual skin discoloration during an unrelated exam, further testing revealed early-stage kidney disease. The skin wasn't the problem, it was the signal. So what can you do to protect yourself? Aim to bathe at least 3 times a week, more often if you're active or live in warmer climates. Use mild, fragrance-free soap that won't strip your skin of its natural oils. After bathing, apply moisturizer while your skin is still slightly damp to lock in hydration, especially on arms, legs, and back. Take a moment to inspect your skin. Are there dry patches that never go away? Itchy spots? Discoloration or bruising that seems unusual? These may not be just age-related quirks. They could be your body's quiet way of asking for help. Taking care of your skin isn't about vanity, it's about vigilance. Your skin could be telling a story your blood pressure monitor never will, if only you're willing to look. 3. Ignoring nail care. Most of us think of nail care as a cosmetic habit, something you do before a dinner party or a vacation. But for older adults, your nails are more than just appearance. They're a mirror of your inner health. Doctors are trained to glance at your fingernails and toenails for a reason. The color, texture, and even shape of your nails can offer valuable clues about conditions like anemia, thyroid dysfunction, circulation problems, and even heart disease. The problem is, many seniors either can't reach their toes easily or simply stop paying close attention to their nails, especially if they no longer wear sandals or open-toed shoes. But out of sight shouldn't mean out of mind. Let's look at Beatrice, 82, a retired librarian who started noticing her toenails were thick, yellowed, and difficult to trim. She chalked it up to aging and wore closed shoes to hide them. When she finally mentioned foot pain to her doctor, she was diagnosed with a fungal infection. But that wasn't the end of it. The infection had worsened due to her weakened immune system, a deeper issue that had gone unnoticed. Here's how you can avoid this. Trim your nails regularly, straight across, with slightly rounded edges to avoid ingrown nails. Keep nails clean and dry. Use a soft nail brush if needed to gently remove buildup. Wear breathable footwear and change your socks daily. Moisture trapped around your toes can be a breeding ground for bacteria and fungus. Inspect your nails once a week. Do you see ridges, unusual spots, or dark streaks? Are your nails brittle or unusually thick? These aren't just cosmetic concerns. They're your body waving a warning flag, sometimes before any lab test ever picks up a problem. Don't ignore your nails. They may be small, but they have a lot to say if you're willing to listen. 4. Poor incontinence management. Let's talk about something many older adults experience, but almost no one wants to mention: bladder control issues. It's more common than you think. In fact, studies estimate that over half of seniors deal with some form of incontinence. Yet instead of seeking help, many try to hide it with makeshift solutions: folded paper towels, frequent wardrobe changes, or planning outings around bathroom access. But here's the truth. Ignoring incontinence doesn't make it go away. It makes it worse. Left untreated, it can lead to painful skin infections, frequent urinary tract issues, increased fall risk, and even signal serious problems like prostate or bladder cancer. Douglas, a 73-year-old retired accountant, experienced this firsthand. Too embarrassed to bring it up with his doctor, he managed his leakage with paper towel liners and extra changes of clothes. By the time he sought medical help, due to painful sores, he was diagnosed with a prostate condition that had gone unchecked for months. Earlier treatment could have changed everything. So what should you do instead? Use proper incontinence products, not household substitutes. Modern briefs and liners are designed to wick moisture, prevent skin damage, and minimize odor. Clean up thoroughly and gently after each episode to protect your skin, especially in sensitive areas. Use non-irritating wipes or warm water and a soft cloth. Speak openly with your doctor. They hear about this issue every day, and they won't judge you. They can check for underlying conditions, adjust medications, or recommend therapy to strengthen pelvic muscles. Plan smart, but don't isolate yourself socially. There are ways to stay active and confident without letting incontinence control your life. Remember, incontinence is not a shameful secret or an unavoidable part of aging. It's a health symptom, one that deserves proper attention and care. Don't suffer in silence. Getting the right help could restore your comfort, confidence, and peace of mind. 5. Improper ear cleaning. Let's be honest, Most of us grew up thinking that cleaning our ears with cotton swabs was part of a healthy routine. It's what our parents did. It's what we've always done. But here's what doctors now know. That habit can actually be dangerous, especially as we age. Your ears are self-cleaning. That's right. Earwax, or cerumen, has a purpose. It traps dust, bacteria, and other particles to prevent them from reaching deeper parts of the ear. But when we forcefully insert cotton swabs, or worse, sharp tools, we're not cleaning, we're pushing wax deeper and risking damage. Patricia, a 71-year-old retired librarian from Washington, learned this the hard way. She routinely cleaned her ears with cotton swabs, inserting them well into the canal. One day, she punctured her eardrum. The injury led to a painful infection that required emergency care and caused permanent hearing loss that could have been avoided. So what's the safer approach? Never insert anything smaller than your elbow into your ear canal. Yes, that old saying is still true, and for good reason. Clean only the outer part of your ear using a warm, damp washcloth. If you suspect earwax buildup, use over-the-counter ear drops specifically made to soften wax, and follow the instructions carefully. If you experience symptoms like hearing loss, ringing in the ears, itching, or discharge, see a doctor. Don't try to treat it yourself. One important point for older adults. Our ears become more sensitive over time. Age-related hearing loss is already common, and damaging your ears through aggressive cleaning can make things worse, quickly. Your hearing connects you to loved ones, to music, to the world around you. Don't risk it for the sake of feeling clean. Instead, treat your ears gently. Listen to what they are telling you, and let professionals help when something feels off. 6. Neglecting foot care. When was the last time you really looked at your feet? Not just a quick glance, but a thorough check of your soles, heels, and between the toes? For older adults, the feet are often the first place serious health problems show up. From diabetes to circulation issues, your feet are sending signals that many of us miss, simply because we stop paying attention. Many seniors struggle with foot care for a simple reason: mobility. It's not easy to bend down, trim nails, or inspect dry skin, but ignoring your feet can have dangerous consequences. In fact, podiatrists estimate that up to 85% of diabetes-related amputations could be prevented with basic foot care and early detection. Let me introduce you to Raymond, a 76-year-old retired factory worker from Illinois. He had been living with cracked heels and occasional numbness in his toes for years, just assuming it was part of getting older. But during a routine checkup, his doctor noticed the condition of his feet and ordered a blood test. It turned out Raymond had undiagnosed diabetes. Catching it early made all the difference. So what should you do? Wash your feet daily with warm water and gentle soap, then dry them completely, especially between the toes. Apply moisturizer to dry areas, but avoid the spaces between your toes where excess moisture can lead to fungal infections. Inspect your feet regularly for cuts, blisters, color changes, or signs of swelling. Wear clean, breathable socks made from cotton or moisture-wicking fabric. Change them daily. Choose properly fitting shoes that support your arch and allow your toes to move freely. Tight shoes can worsen circulation and cause injury. And most importantly, don't ignore foot pain, numbness, or slow healing wounds. These may be the first signs of something much bigger happening inside your body. Healthy aging starts from the ground up, literally. Take care of your feet, and they'll carry you farther than you think. 7. Hygiene changes caused by medication side effects. You might be doing everything right, bathing regularly, brushing your teeth, staying active, yet something still feels off. Maybe your body odor has changed, your mouth feels unusually dry, or you're sweating more than usual at night. The surprising culprit: your medications. As we age, most of us take multiple prescriptions, sometimes 5 or more a day. But what many don't realize is that some of the earliest signs of medication side effects show up as hygiene changes, not as pain or illness. These subtle shifts can be easy to overlook, but may point to something serious happening beneath the surface. Take Barbara, a 67-year-old retired nurse from Florida. Despite showering daily and using deodorant, she noticed her body odor had changed. Her family assumed it was just part of aging, but her doctor knew better. After running tests, he found liver damage caused by medication toxicity. That odor was her body's way of crying out for help. So what should you be watching for? Keep a journal when you start a new medication. Note any changes in odor, sweating, saliva, or skin appearance. Stay well hydrated unless your doctor advises otherwise. Dry mouth and skin are often early signs of drug-related issues. Don't ignore sudden changes in personal scent, even if others dismiss it. Most importantly, never adjust your dosage without medical supervision. If you suspect your medication is affecting your hygiene or overall comfort, speak to your doctor right away. Doctors from the American Geriatric Society warn that nearly 40% of adverse drug reactions in seniors begin with hygiene-related symptoms. That means your body could be showing signs before labs or scans detect anything wrong. Your hygiene isn't just about cleanliness, it's a reflection of your internal health. If something smells off, feels off, or seems different, don't brush it aside. Your medication may be trying to tell you something your body can't say out loud. Aging comes with many changes, but losing control over your health and dignity doesn't have to be one of them. What we've covered today isn't just about personal hygiene, it's about something deeper. Listening to the quiet signals your body sends before bigger problems arise. From brushing your teeth and inspecting your skin, to paying attention to your feet, nails, and even the effects of medications, these small, often overlooked habits can reveal so much more than surface-level cleanliness. They can be the difference between early detection and silent progression, between staying independent or becoming vulnerable to preventable health issues. The truth is, many seniors don't neglect their hygiene out of laziness. It often comes from a lack of awareness, difficulty with mobility, or feeling embarrassed to ask for help. But ignoring these signs won't make them go away. In fact, it could allow serious health issues to take root undetected. So here's the takeaway. Make hygiene part of your healthcare strategy. Treat it with the same importance you give to your medications or doctor appointments. And if something feels off, if your skin itches, your gums bleed, or your body odor suddenly changes, don't dismiss it as just aging. These are real signs worth your attention. You've worked hard for a lifetime. You deserve to live these later years with clarity, strength, and dignity. And sometimes all it takes is a closer look in the mirror and a little courage to ask the right questions. So take that extra moment each day. Your future self and your loved ones will thank you for it.